So for me, it was always really about getting to the root of the problem, right? To really help people so I wouldn't have to see them again. And as a chiropractor, we learned that, our back pain or pain within the spine is related to degeneration, maybe arthritis. There could be a disc bulge or disc herniation, maybe some spondylolisthesis, scoliosis. So there's a lot of things that could contribute to this people's pain. And as I started to work with people, some people would get better, but a big majority, would keep having to come back. Whether that's monthly or weekly, or some people wouldn't come, would feel good, and then 6 months later they're coming back and with the same pain. And so, I started to dig deeper, and what I realized was that from a chiropractic and adjustment standpoint, they really make an adjustment for a pelvis that's gone forward or backwards. But what I started to notice is with a big portion of people's pelvis actually was one was higher than the other. There was such distortions patterns within the pelvis. And so I started to early on started to work on correcting those type of posture stuff related issues. And that could be related to, organs as well. Sorry, not organs, but muscle imbalances that are causing this structural stuff, or pelvic misalignment. But, again, I started seeing people, and that would help more people. But again, still people are coming back with the same sort of distortion, or, they would go and be good, and months later, a distortion like that would come back. So to me, that just told me that there was actually something else that was causing the person to come back. What was the root of why, what was different? And people, and at first I thought, well, it just an unwinding process of people like, over time, just you kind of go back. But to me, that's just, like when you cut yourself, you should heal and it goes away. The odd person gets a scar, and there's understandable, but most people, the cut's gone, you never see a cut again. So I just kept on trying to research, and that was really what led me to keep reading research and studying and learning, that I really understood that the problem actually stems deeper. So there's more of a psychosomatic issue. And in really, and so it's meaning it comes from your mind in your body. And I'm not saying your mind created the problem. It's based on really stress. And that stress could be, stress that's going on in your life. But a lot of times it's actually unresolved stress or repressed stress. But really in this video, what I wanted to share is really proof, the research that shows that your structural problem that you thought it was, research proves that shows that it's not. And that's really the point of really this video. So I want to bring up the actual study here and just kind of outline for people just to see this for themselves. And so as you can see, the pathology means your issue, whatever that issue might be. So that could be, as you can see, disc degeneration, spinal loss, height loss, disc bulge, protrusion, and there's a lot of numbers. So pathology does not always equal pain. So your disorder, your problem, which your doctor tells you have, isn't or not always causing or equal to pain. So as you can see, reading that, right, is significant. But as you highlight it is really what's important. So if you have a disc degeneration, you're starting at 20 years old, 30% of people have disc degeneration. And obviously, as you get older, the higher likelihood. So by the time you're 60, 88% of the population has disc degeneration. And so what happens is that, most people from, chiropractic come from 40 to 60 is a big portion. Well, 68 to 88% of those people are bound to have disc degeneration. You can see even the numbers are high for disc loss, disc height, right? A disc bulge. Look at that. 50% by the age of 40 have disc bulge, or meaning the disc is out, right? And so what happens, they'll come in and we're going to do some kind of imaging. So that might be an X-ray or MRI. And we notice, oh, you got a disc bulge. That's what's causing your pain. However, they had that pain or could have had that pain for the last 20 years. 30% of them. So, and as you get older, as you can see on all these numbers, the numbers increase. So this is just simple proof that the older you get, the higher the likelihood of having some kind of structural anomaly. It's not an anomaly, a structural change and distortion in the body. So and then we check it through imaging of X-ray or MRI, and all of a sudden it's like, boom, it's confirmed on X-ray. But as you can see, 30%, 20 to 30% of these changes are starting in your 20s and it increases by 30. It's double in most cases, as you can see. And so that's just, proving that there's something else that's causing this people's pain. And so if it is structural, great, the chiropractor should be able to fix it. However, if people are going to the chiropractor and not seeing results or not getting, or can't seem to get beyond the adjustment, or whether it's physical therapy, chiropractic, massage, there's something likely deeper that could be causing their problem. And I would recommend them to reach out.